live Facebook chat. Really excited for this week's guest. So I'm going to give everybody a chance to come into the chat. And before we get started, I always like to start just by asking you guys where you're from, how old your kids are, a little bit about you, if you're a new follower here, or if you're a longtime follower of NJ Mom. We always love to hear that. So I'm going to wait for some of your comments to come rolling in, and hopefully we see some familiar faces tonight, and also some newcomers, which we love to see also. So please give us a shout in the comments if you are new joining us here tonight for our weekly live Facebook. For those who don't know me, maybe you're new tonight, my name is Marissa Brainy. I have 3 little ones at home, so I'm right there in it with you all going through this very challenging time. And I work with NJ Mom, hosting NJ Mom TV, which is our YouTube channel, and here on Facebook Live. And this event gives us really a great chance to connect with moms all around New Jersey. And we just love hearing from you and getting this chance to kind of talk about everything together. So I look forward to this every week, and I hope you do too. And I hope if you're new here tonight, you join us again next week for it. A little you time to kind of decompress and talk about all the things that we're doing right now. So with that said, would love to hear from you. If you are a first-time NJ Mom viewer / follower, please let us know. While I do that and wait to hear from some of you about who you are, where you're from, your kids, all of that, please let me know if you had first day of school this week or last week for your kids. I know that it was kind of split around New Jersey. I know our town started this week virtually. Towns surrounding us started last week. So please let me know here. I also want to let you know that I had a little technical glitch setting this up. So please shoot me a little smiley face or heart or something if you can hear and see us. Let us know. I just want to make sure everything is working well on our end, because we had some technical glitches getting this all set up. So while I do that, let's see. A few things to get to as we start this off. We have been doing these throughout the pandemic, these live, and every week we always start by just giving all essential and frontline workers a moment of thanks and a moment of appreciation. And it's particularly applicable tonight, which we'll get to our guest in just a few minutes. But if you are joining us and you are on the front lines in any way, especially our healthcare workers, we salute you, we thank you, and we just really want to show our appreciation for all that you are doing, continue to do. Thank you, thank you. So, oh, good. I'm getting some comments. Hi, everybody. Good. Oh, good. You can be great. First day of school last week, full-time, 5 days a week. Mary, anxious to hear from you a little bit more about how things are going. Please let us know. I hope things have gotten off to a good start for you and your kids. Christina says, school nurse in New Jersey, and we opened this week. Yes. How are things going, Christina? Let us know how it's going in that realm. I'm sure school nurses have a lot that they're taking on as well, so would be interested to hear about that. While we wait for some more folks to say hi, some more mamas to say hi, just want to talk about a couple things that we always love to do at the start of our weekly chat. We want to tell you about some great events that are happening with some of our NJ Mom partners, and this one is so important. This piggybacks off of what I just said, really thanking all of our healthcare workers and our frontline workers. RWG Barnabas Health is doing a fantastic event. It's a run to honor healthcare heroes, and it's with the New Jersey Devils. So it's really fantastic and just so important right now to honor the people who have been there through us for all of this. The first 100 NJ Moms to register, by the way, will receive 25% off if you use the code NJMOM. And 100% of the proceeds of this will go to the RWJ Barnabas Health Emergency Response Fund, which is helping protect both patients and healthcare workers from COVID-19 and other emergencies. So super important cause, super relevant right now, and just a great event to get involved with. It's virtual. We have a whole write-up on our site, and we're going to be linking everything we're talking about in the chat for you. We'll drop those links there for you so you can check that out. Bear with me for a moment because I want to make sure that this is working correctly. Let's see. Okay, good. All right, excellent. Okay, good. I'm so glad all of you are getting this well. Technical issues. I mean, I know all of you moms who are doing the Zoom and virtual learning can relate to this. Right now, we're relying so heavily on technology, so fingers crossed this all continues to go. So we're dropping the links in the comments for all of what we're talking about. But in addition to that, some other great articles up on the site this week that are new if you haven't gotten a chance to check out. If you're new to NJ Mom, we are known for really all the best places, events, things to do with your family focused, and the fall is a perfect time to do that. So we have all of our favorite fall guides from around New Jersey up on njmom.com for you. I know just from the past few weeks, a lot of you said that you've already perused them, already gone to some of the favorite stops on there. So if you haven't given them a look, please do that because they're awesome and it gives so many great options to do right now, socially distanced, outdoors. So many places are really taking precautions and rolling with everything we have to do right now. So check that out. We also do a weekly series that is such a favorite for our NG Mom community. It's our NG Mompreneur of the Week. Always love to highlight these amazing moms and entrepreneurs who are doing fantastic things both for their families and for their businesses, and right now having to get so creative with the pandemic. So this week, I had the chance to write this one this week. It's Lauren Vina. She is a makeup artist by trade. She's been in the industry for 20 years, but she recently just wrote a children's book, and it's just a very interesting story and background, and I loved hearing from her about kind of how that all came to be. So great interview, great article. Check it out if you haven't. Just a really great series that we do. Speaking of fall, which I was just talking about the fall guides, we have kid-friendly fall festivals around New Jersey. So these are fun for the entire family. Lots of great options like apple, pumpkin picking, hay rides, music, apple cider and donuts, which everyone loves, food, games, all that. So we have a roundup for you. Fun for every age. Also, 9 kid-friendly things to do this week, and some of them fall festival related, others not. Big Snow at American Dream, which was highly anticipated here in New Jersey. That is newly reopened. There's the Ort Farm Fall Fest Valley, and then I love this one. This is Duffield's Farm Food Truck and Apple Fest. Anytime you combine food trucks and a farm, I think a lot of fun. So that's another one that we highlighted also. So check that out if you're looking for something to do this week with the kids, maybe get a little break from the back to school thing. All right, I want to respond to some comments real quick. Let's see. I'm so glad you're hearing and seeing me. Okay, good. Virtual learning for Dana. Christine says, so far, okay, temperature checks, questionnaire every morning, lots of disinfecting. Thank you for all you're doing. I know that it is not easy to do all that in addition to all of your regular duties, so we appreciate it. Mary says, so far, so good. Lunch has been held outside this week. That's nice that they're doing that. I know a lot of schools are trying to do outdoor things. Staggered drop-off and pickup. Yes, the kids are happy to be back in school. I know my son is as well. He's pre-K, but for him, this has just been awesome. I'm so glad to see you all here, and please continue. If you're just getting into the chat, please drop us a line in the comment. Let us know where you're from, how old your kids are, and how long you've been following NJ Mom, and how everything's going with back to school. We'd love to hear. Okay, a couple other things I do want to mention, a few new articles and other things before we bring in our guest tonight, Dr. John Sicat. I know a lot of you have questions for him, so we'll get to him in a moment. But a few other articles if you haven't seen. The Spine and Sports Health Center in Hudson County just opened its Jersey City location. So that's an update. They're having a ribbon cutting for that actually this week, but it's a new location serving the people in that area. And we have a highlight on that, 5,000 square feet of space there. So I know a lot of moms struggle with pain of various sorts. And so if you're in the area, definitely check that out. Also, this got a lot of interest last week when I brought it up. A few moms said, oh, I want to do that. You can try self-care products and actually get paid for them through CPT Labs, which is here in New Jersey. There's an eyeliner study right now, a facial lotion study going on. You can get paid up to $200 for these. So if you love to kind of experiment with new products anyway, this is a great option. So check that out as well. That's up on Engineering. And then one other thing to mention, great event that's happening right now, actually going on through October 13th. This is the Hoboken Wellness Crawl virtual event. So this has been a big event over the past few years, really. I remember the past couple they've had this. Of course, everything now virtual, but this is going on for 30 days. And it's beauty, it's wellness, fitness deals. This is more than 100 vendors in the area. So this always draws a big crowd. Definitely check out the write-up on the site because you might be interested in the events they're having. A lot of fun. And again, kind of a break, a little self-care moment. So need it. All right. And in addition to that, I always want to just let you guys know, if you don't, here on Facebook, we choose a Facebook cover photo of the week. We always love seeing your pictures. On Instagram and on Facebook, you guys share the best photos of all of your NJ Mom adventures with your families. Always love to see them. So thank you for hashtagging NJ Mom. Thank you for sharing them. We choose 5 new cover photos every week here on Facebook. All you have to do is comment on our cover photo post. Just comment a picture, and we choose 5 of them. We also do lots of roundups with that too. And I know all of the fall and back to school photos a little differently looking this year, but nonetheless, they're great. Thank you. Okay, I am just going to see if I have any people to respond to here. Let's see. Oh, hi, Walter. Nice to see you. Glad you're here. I know I'm not a mom, but I wanted to say hi. Well, thank you for saying hi. I know some people are finding us new tonight, and so if you're here for the first time, checking in on what we're doing with NJ Mom, we appreciate you being here. Thanks for watching. Let's see. Oh, I want to just mention again, any of those things I just talked about, we are dropping the links in the comments for you. So please check those out. Click on them if anything caught your attention. All right. Okay. I want all you mamas to get your questions ready for our guest tonight. I think this is going to be super informative and just such an important chance for us to talk about all of the health and safety concerns that we have right now with this back to school season. So I'm going to bring in our guest, Dr. John Sicat. He is the Director of General Pediatrics at the Children's Hospital of New Jersey at Newark, Beth Medical Center. Loop him in now. Okay, good. Hi, Dr. Sicat. How are you?
Hi, how are you?
Thank you so much for being with us, first of all. I know you're very busy. Obviously, there's so much going on. You were telling me when we spoke earlier, in addition to all of your responsibilities at your professional level, you're also a dad. So you're right there with us in this back to school season and this season of transition, really.
Yep, exactly.
So first, I just want to give you a chance to tell us a little bit about you and what you do and your position at Newark Beth Israel.
Okay, so actually I am an internist and I'm also a pediatrician, which is kind of an interesting thing in that I care for both adults and children simultaneously. I've been in primary care practice for over 20 years, and I've been doing inpatient internal medicine and pediatrics and outpatient internal medicine and pediatrics over that time. I do a lot of work with residency program stuff, internal medicine, pediatrics, and the combined internal medicine and pediatric residency program. So we take care of people of all ages. I like to say it doesn't matter what diaper size you have, we take care of you.
I never heard it put that way before, but okay.
I'm going to put it on my business card, diaper to diaper. I have taken care of, during the height of the pandemic here at the hospital, I did take care of a lot of COVID positive patients. So up close and personal, I was in charge of a floor at one point of, all COVID patients. So, and that was a few months back. I do have two children of my own, so I'm a New Jersey dad, and I'm married to a New Jersey mom. My kid, my kids are. I have a 15-year-old in high school and a 10-year-old that's in fifth grade. So I know what a lot of you guys are going through. Maybe not as much as my wife does, but yeah, it's been a very interesting time.
Yeah, you get it. I mean, for a variety of reasons. So I guess first, let's talk a little bit about common concerns that moms, parents have right now with the return to school. Everyone's return to school looks a little different, but what are you hearing generally from your patients and from parents you speak with about their pediatric health concerns in this time?
Yeah. So, yeah, the big question initially was, our school is going to be face to face? Are they going to be virtual? Before the school year started, it was a big, very big question that everybody had on their mind, and that determined, a lot of the stress that parents were having, trying to deal with whether or not they would have to be homeschooling their kids or at least watching them while they were virtually in school, or if it would be business as usual and you're going into school. So that was a huge concern. So there's a big and everybody's all over the place, like you're saying.
Right.
Some kids are virtual, some are face to face, and so everybody's got different stressors that are affecting them. Even we've had moms that had to change their work hours. Either they were forced to come in late or go part-time, or actually just go per diem, as workers because they had to, take care of their kids and school. And that has a huge effect and a huge stress on whether it's financial concerns or just the logistics of getting everything taken care of. So we had a lot of parents and kids that were very stressed out just based on that. I ask mothers all the time, I'm like, how are you doing with COVID? And I hear all sorts of, varieties of answers. And they ask me, what my opinion is in terms of what's going on. What should I do with my kids?
Right.
And everybody's situation is different because everybody's got kids. Some have kids that are healthy. Some have kids that have diseases like heart disease, and some have parents of kids that have bone marrow transplants, and they're like, do I let my kid go virtual? The good thing is that a lot of schools have, they've been flexible enough to offer both. At least a number of the different schools offer virtual versus face-to-face learning. But that was a huge stressor for a lot of parents.
Yeah.
Parents worry about whether or not their child is going to get sick in school. They worry if their child is going to bring home something to either themselves or to their elderly parents that they live with that are like 90 years old with, diabetes and high blood pressure. So a lot of stress going on for all these months.
So let me ask you about a couple common things that have come up a lot in our NG Mom community. We poll our NG Moms weekly right now to just kind of gauge what people are thinking about and talking about and worrying about with this transitional time. So a couple things that have come up over and over again. I'm going to start with masks because that just has been a huge thing throughout this. But at this point, a lot of kids maybe used to wearing it, but now that they're transitioning to being in school, potentially part-time, who's enforcing them keeping the masks on? How do we know our child is keeping the mask on? How do we know other kids are keeping it? So I guess what would you say from a medical standpoint, or maybe some things that moms can be thinking about to sort of help that situation, or just some general tips that you have?
Yeah, so in general, masks are very important. We know that in some ages it's impractical to keep a mask on, and even in the American Academy of Pediatrics doesn't recommend a mask if you're less than 2 years old.
Right.
However, above 2, most institutions expect children to wear masks, and even the young kids, it's expected and it's recommended, and it's difficult at times to enforce, but definitely recommended. There are certain requirements for masks that we like. We like double multi-layer fabric or filter even included in the mask. Um, you should make sure the masks fit comfortable in kids. If there's a chance that they're going to wear it for a prolonged period of time, there's a better chance if it doesn't irritate their face. Um, Definitely masks are recommended, and I think it's a good idea to even teach kids how to put them on and take them off. I mean, theoretically, when possible, you're supposed to wash your hands and sanitize them before you even touch your mask to put it on, and do the same thing when you take it off, and try to avoid touching your face. But whether or not kids and adults can actually
Right.
follow that is somewhat suspect.
Yeah, I mean, my just for an example, I know a lot of moms have been dealing with this with younger kids. My kids are on the younger side, so my oldest is 4.5. He's back in school, part time, and wearing a mask, and he's doing well with wearing the mask. And so is my younger one actually, and he's going to be 3 in October, but not so great with not touching it. I mean, he's just, he's a fidgety 4-year-old, and sometimes I like stress myself out about that, but like, what can I do to kind of, get him to get it a little bit more?
Yeah, I mean, I think parents is modeling. Parents is
Right.
modeling for their masks. um, just showing them that they can do it, and this is how to do it. You should do it too, and also reinforcing the idea that they're doing good by wearing a mask, by protecting others. At least they get that positive reinforcement that this is a good thing. They'll be more motivated to do that because they realize that they're helping others, even though it may be uncomfortable for them.
Now, you were saying about the filter. I have a question about the filter. This is just something that so the filter's supposed to come out every time you wear the mask. The mask gets washed, the filter gets discarded. Is that like the general idea?
Yes, exactly. I mean, there are different filters, and there's all sorts of thoughts on particle size and what the filter should do. But theoretically, the higher end N95 masks, they filter 5% of particles that you expect them to filter, with particle sizes of like 0.3 microns. A lot of the the coronavirus theoretically is like only 0.12 microns, so actually smaller than what the filter is supposed to filter. But you got to remember that those particles are usually attached to things like liquid and your respiratory secretions. They don't generally get to the mask. Yeah. So theoretically, you should have some kind of filter. Whether or not it needs to be, that level of a filter.
But definitely, like a double layer is.
Oh yeah, definitely double layer. Double layer fabric, and washing it every day. To keep it clean at least every day. Or to change the mask if it's a disposable. Yeah,
that was something, I mean, even getting ready for school, I know a lot of moms we heard from said, I'm buying enough masks for however many days of the week that I know we're going to be out of the house. So yeah, okay. Another thing that we've heard a lot about, this is sort of on the flip side, is the staying home aspect of it, is screen time. And, just the impact and effects. I mean, since my kids have been born, many of us moms really, are trying to avoid too much screen time. And, obviously throughout all of this, it's been really hard to do that. Even if kids aren't virtual learning, if you're working from home in any capacity, like it's just needed right now. But I don't think any of us anticipated this was going to be, such a lengthy thing. So now that we're 6 months in, what do we need to be thinking about with screen time?
Yeah, screen time's a little tricky.
Very.
There are American Academy of Pediatric recommendations for screen time. Pre-pandemic, were people following them? A little questionable. But if you are less than 18 months of age, theoretically, we don't recommend any screen time. From the AAP standpoint, and even 18 to 24 months, the screen time should be minimal. I mean, they do make some exceptions for like communication with grandparents, but if you can imagine, 2 years or less, screen time is supposed to be minimal or not at all. But, we've seen lots of 18-month-olds that can play with those iPads or phones. And, should they have been? But, whether or not they should or shouldn't have, that's one thing. But now we have, if you're above 2 years of age to 5 years of age, the recommended screen time is only an hour.
Mm-hmm.
And that's almost like an hour. You got to be kidding me. It's only an hour for someone that's 2 to 5. And then we throw in school age kids where they don't recommend a specific number of hours, and it would be very difficult to enforce because now the schools have no other option except to utilize for hours and hours. So I think, if anything, you should probably set up some rules using screen time, because you do need time without screen time. Just time to play and do other things. Because even after school, kids are going to want to play video games. They're going to want to do stuff on a screen. But I think it's important to set some screen time rules. Like, for example, no screen time during meals. If you're eating, no phone, no iPad, nothing next to you. It's time to talk to your parents. And, an hour before you go to sleep, you need some of that downtime. You don't want any sleep disturbance issues. You need that time to wind down. No screen time an hour before sleeping. Depending on if your homework is on a screen or not, no other screen time during homework if it's non-screen homework. And other things like no, obviously in an older child, no screen time while you're driving. Basic things like that to avoid, problems like motor vehicle accidents. But screen time is a very difficult thing because, pre-pandemic, it was very difficult for parents to follow some of these guidelines. They were definitely recommended, but we saw a lot of times parents going way over what the recommended times are supposed to be.
Well, I think for many parents now, it's it's a necessity for a variety of reasons, but virtual learning being the big one. So, I think that, I guess, what would you say about, maybe the importance of breaks throughout the day, and like how parents should think about those breaks and really utilize them to kind of give everybody's eyes a rest and the screens a rest and all of that? Like, any tips for how to do that best?
Yeah, I think schools, from what it sounds like, have been pretty good about giving students breaks. Like an hour on a screen, you should have some kind of break, especially even in older kids and adults. An hour is a good amount of time without taking a break. And and those breaks should be, walking around, stretching. And some schools have instituted like organized breaks. Like they'll do different things, like have a dance party during the break just to get people moving. You can have your kids learn Fortnite dances on your break because there's a ton of those that my kid knows. So, but definitely at least 5 to 15 minutes in an hour of a break, doing
to be
something
up and moving and right.
Yep, exactly. I think that's important.
I think that's a good rule of thumb. Is that what you do with your own kids?
I like to think that I do.
I'm not putting you on the spot on purpose, but I know we're all in this together. We're all trying to sort of wade through this and figure out how to realistically, do what we know our kids need in these sort of situations. So with that said, I know that for the virtual aspect of it, screen time's been, really huge for parents. Socialization has also, come up so much just in our NG Mom community in doing these weekly live chats. It's a concern for me. It's, big reason why we sent our 4-year-olds back part-time, feeling safe with the precautions and all of that. But what would you say to parents who are concerned about that? Like, how concerned should we be at various ages about the impact that socialization has, health speaking?
Yeah, the socialization aspect is a real issue. We've had, especially in older kids, a lot of, older kids, normal, healthy kids having a hard time, getting either depressed, very anxious about not seeing their friends. Um, and that's for a well child. We've had, if you can imagine an autistic child that's used to going to a daily program that all of a sudden doesn't want to eat anymore because they're not in their regular, situation. So we've had a lot of struggle and a lot more parents that have identified in their 12, 13-year-old, they're struggling with the anxiety part. Um, so, I mean, there are ways to socialize that are possible, especially if you maintain the concept of doing socialization outdoors. Mm-hmm. Whether it's doing some kind of sport outdoors, whether it's tennis or golf or hiking or biking, there are ways to socialize them and minimize the risk of getting the infection in your kids. And even in younger kids, they're having issues in that they're not able to socialize. They're not able to learn the things that they're supposed to learn when they're young. There was that book, Everything I Needed to Know I Learned in Kindergarten. Right. Kids aren't having regular kindergarten, and so they're not learning how to share. They're not learning how to, manage their emotions and things like that. And I mean, hopefully when this all goes away and things get better, they'll learn it eventually, hopefully. But, there's a lot of missed opportunity to get normal things done, especially from the socialization part.
Yeah. I'm going to just pause here for one moment. I just want to make sure everyone knows that they can ask questions. So please, if you have questions for Dr. Sicat, please let us know. I did have Nicole. Hey, Nicole, happy you're here with us. Just drop a comment that her son Liam is starting to learn how to wear a mask and he's 2. So for moms who do have that really younger age, maybe you're just 2, starting to kind of get them used to it, you would recommend at that point, right, Dr. Sicat?
Yeah, I think that's like modeling, having the parents do it and showing them this is how to wear a mask. They will learn. They may have trouble. They may not be compliant some of the time, but if they're starting to learn and doing it, it's fine. I think also too in the big picture, coronavirus in children it's really been limited compared to what it was in adults. I mean, at one point, coronavirus was bad. A couple months ago, hundreds and hundreds of patients hospitalized but with all those hospitalizations and COVID positive patients, it was very relatively few in children. So I think knowing that, yes, coronavirus is bad for some, in children, it's actually very limited. So I worry a lot less about my kids, and I worry more about the adults that are around them as opposed to my children.
Right.
And hopefully, parents can feel a little bit more comfortable that they don't have to go too crazy if their children, don't comply 100%. It'll be okay. Mm-hmm. The risk in children is relatively very small.
Mm-hmm. All right. Well, I know that that's always good to hear again for moms. I know we've been hearing that a lot through this, but it's good to see that thought in the medical community is continuing as this goes on, because I think that the thing that is so difficult about this entire situation is that because it's something new, we've learned a lot about it over the past 6 months that, initially we didn't think it did this and then it did. And, so the idea that we thought it wasn't as prevalent in children and that idea has stayed, I think is a comfort for many parents to know that it's still.
Yeah, I think you might see more cases in children, especially as they're testing more kids back in school. However, even if they test positive, the likelihood of them being sick or even hospitalized is really, from a percentage standpoint, very low. So you may get positive children, whether they're symptomatic or not. But in terms of, are they going to be sick enough to, need true medical care, be hospitalized, or even, suffer anything tragic, is very unlikely.
One other thing that we spoke about ahead of time, which I really just want to give you the chance to kind of share with our NG moms, is some tips for immunity boosting for, the school year. Obviously, we moms, always want to know about that when it comes time to winter and just general sickness. But now I think it's just top of mind for us so much more. So anything we can do on our own that really, helps strengthen the immune system for the kids.
Yeah. Yeah. In terms of immunity boosting, it's all the kind of run-of-the-mill boring stuff, right? Eat right, exercise, eat your vegetables, eat carrots, eat the green stuff, spinach, broccoli, green beans. I mean, that's, stuff we should be doing anyway. And, getting our share of vitamins, getting a well-rounded diet in, keeping active and exercising. I think some of the less, I guess, known things are things like, breastfeeding your new infant. If anything can boost immunity, especially in that age group, it's doing the breastfeeding part. I think a lot of people in the country are not as attuned to breastfeeding as they are in other countries. Some countries expect you to breastfeed. Here in the United States, there's a lot less of that expectation, especially since we have formula so conveniently available to people. However, breastfeeding is one of the best things you could do for your infant's immunity that will last even later on in childhood. Things like avoiding secondhand smoke or smoking at all are things that, smoking will decrease your immunity. And I think something that's not as obvious is that, if your child or an adult for that matter gets, a viral infection, don't look especially to your provider for an antibiotic. I think the prescribing of antibiotics actually makes it harder for your immune system to work because, the bacteria that gain strength because of antibiotics that weren't needed makes it tougher to treat later on. So doing those things. And then there's the vitamins that, people talk about. There's vitamin A, so in all those foods that you're eating, you want a combination of vitamins to boost your immunity, whether it's, vitamin C, is big, vitamin D.
I also just heard about vitamin D. In fact, our doctor said something about it, and I hadn't heard about the importance of vitamin D related to coronavirus before this. And it wasn't, I guess, a supplement that was like on our radar for family health. And we've done like the elderberry and things like that, just general multivitamin. So can you tell us a little bit more about the vitamin D aspect and how important that is with this?
Yeah, vitamin D, definitely. It's something that a lot of people are deficient in just because of they don't get enough sunlight, for example, because that's what converts in the skin to vitamin D. So, a third of the population is probably vitamin D deficient. So taking supplemental vitamin D in some kind of form, either getting enough sunlight, but as the weather gets colder and you get less sun, vitamin D levels will probably go down a little bit. Something to the effect of like, if you're looking for a dose, about up to 4,000 international units of vitamin D is what you might want to see. So vitamin D probably got a little bit more popular or got a little more press with Dr. Fauci. I think he started taking vitamin D. So when people heard that, I think a lot more people started thinking about it. Things like zinc also might boost your immunity. And you mentioned elderberry too, is something that people have been looking at for immunity boosting as well. So, if nothing else, you could take a multivitamin a day. If you don't eat well, if you don't eat a balanced diet, at least if nothing else, take a multivitamin.
Right. Yeah. And that can always, that's in conjunction with healthy eating. I should have prefaced by saying that that's not a replacement for healthy eating in any way, but it's just a little something extra you can do if you kind of do that.
Definitely.
Okay, I wanted to just ask one more thing here. Something related to, in terms of like the sanitizing, I think, a lot of moms worry if their children are younger with like the overuse of hand sanitizers, kids are putting their hands in their mouth, things like that. Any thoughts on that from a pediatric health point of view, or anything moms should be concerned about as we're doing that so much these days?
Yeah, I know. There's, especially in the stores, you'll see hand sanitizer all over the place
It's
now.
everywhere, every corner.
Right, and so some people believe that being exposed to some germs is actually good for you,
Right.
in the sense that a lot of pediatricians don't get sick very often because we have kids coughing in our face all the time, pre-mask, and we build our immunity by being exposed to germs. So there's a little bit of a debate whether or not we should be sanitizing everything. I think most people are going to lean on the sanitizing everything, and that's what for the most part everybody's been doing. Exposure to some germs is okay. So if you miss sanitizing something, don't lose a lot of sleep over it. As long as it's not the coronavirus that you're getting exposed to, it's okay to get other germs, just like you would normally pre-pandemic. So I know it doesn't, tell you exactly what to do, but people are going to sanitize anyway, just because they're going to feel the need to. And I think it's important to, at least for now, to do it as much as we've been doing. I mean, we sanitize between every patient a lot more than what was done in the past, just to make sure everybody is comfortable and everybody's safe.
And then one other thing I wanted to ask, and this is, sort of just, I think, on people's minds as we head towards winter and things like that. What should moms kind of keep in mind for our own peace of mind in terms of if and when our child gets sick this winter? Because we know it's going to happen. I mean, it's a regular winter. My kids have runny noses multiple times. What should we be thinking about and doing differently, if at all, this time around? So to not drive ourselves crazy over every single that may happen in our house.
Yeah. So, I mean, it's going to be an interesting, I guess, season because, whether or not, there's the flu season that's coming up, right? And if flu acts like it's acted in the past, everybody's going to get, people are going to get upper respiratory infections from a virus, whether it's the flu or not. But now it's kind of interesting because everybody's masked and everybody's distanced. So maybe the flu season won't be as bad. But we still would recommend everybody get a flu vaccine. And I think one thing to do is not be afraid to seek medical care, not be afraid to go to the office if needed. And what's nice is that a lot of practices have instituted telehealth in order to seek care without the fear of having to bring your child into a hospital or office type setting and worry about getting exposed to something. So don't be afraid to come to the hospital. We've had people, actually adults mainly, that have been afraid to go to the hospital. They had symptoms. They whether it was leg swelling or chest pain, they're like, I don't want to go to the hospital because I don't want to get the coronavirus. But then what ended up happening is they actually ended up having something more serious.
Something serious, right?
Passed away because they didn't want to come to the emergency.
Oh.
So
So
a little bit crazy, but so just don't be afraid to go to the hospital. Hospitals have put a lot of measures in place to keep everybody safe in this situation. Whether it's institute telehealth or sanitize or screen patients before they come in, there's a lot of things in place to make people feel comfortable about coming in. The danger is not coming in and having something serious, and having something bad happen.
Okay, that's all good to think about. I want to just give everybody one last opportunity because I'm going to be mindful of your time. I know you're a busy man, so if anyone has any other questions for Dr. Sicat, please get them in now. Any parting words while I see if anybody has anything else they want to ask? Just for moms, any words of encouragement to kind of get through this transitional time as our kids head back to school?
Just know that, like I said, kids are fairly resilient to the virus. I mean, the older kids are a little bit more susceptible. But the younger kids, we really have not seen much in the hospital or in the office related to kids that are really sick from the coronavirus. Yes, they can get it. The kids that we do want to be careful with are the kids with comorbidities that have heart disease, have lung disease, because we do want to keep them safe, just like we should be very mindful of the elderly patient that has high blood pressure, diabetes, kidney problems, or is obese. So that's what we were seeing a lot of. But in terms of most kids, especially if they are generally healthy, they will not see much in terms of symptoms, at least bad symptoms from the coronavirus.
All right, awesome. That's good to know. We do have one question from Melissa. Actually, two questions here. What about our kids that don't like the masks? And I know you spoke to this a little bit in the beginning, but for any moms who are just joining us now, maybe touch on that a little bit more. And then second thing, this is sort of the piggyback off that. If there are kids who don't like masks or can't wear them for any variety of reasons, are using things like wet ones and those types of wipe down sanitizers the best option to kind of help with that?
Yeah, like we were saying before, modeling for masks, showing the kids that it's not so bad, can be difficult, definitely in some kids. We don't recommend, anything wet over the face, just because actually that will air trap, which we don't want, because then other problems can happen, like retaining.
I think she maybe meant just like wiping down her hands and right. Things like that. I think, but
yeah, right. So you should still do that. I think that's the safest thing to do at this point. But it can be difficult in some kids, and in some scenarios you just have to improvise and not get too crazy worried if the child, depending on the age, won't wear a mask. We don't recommend it in certain, patients, especially with special needs that can't tolerate a mask, or if they can't remove it themselves. Actually, that's another contraindication to not wear a mask if they are unable to remove it themselves. I mean, it's tough, but in the big picture, hopefully people won't get too crazy worried if you have an occasional child that won't wear a mask. In the big picture, they'll still be okay, and everybody around them will still be okay.
And then this is something that I've been thinking about too. Should we be concerned about kids giving it to other kids who can then give it to their family members? So, for example, in the younger population, where maybe some of the kids are like doing well with their masks, and then other kids aren't. Like, how concerned do we need to be about that transmission that then comes back into our own home?
Yeah, I think overall the jury is still out in terms of whether or not kids significantly transmit to adults. I think there's still a lot of studying that needs to be done whether that happens at all. I think there's a lot of debate going on. So on the safe side, yes, we do have to protect our adults from our children, but at least the preliminary evidence shows that it's very limited in terms of what kids transmit to adults. But there's still a lot of debate. There's still a lot of studying that has to happen. But it's less likely for a child to really give this disease to adults, and it might be related to droplet size too, because things like tuberculosis, kids don't give adults tuberculosis because they can't cough up a droplet size enough to infect an adult. So similarly, it may be that, but it's very preliminary, and in the big picture, it seems like it's limited in terms of what kids give to adults.
Okay, well, I think that was really helpful. Thank you all so much for your questions. And thank you, Dr. Sicat, for being with us. We really appreciate you taking time out of your schedule to give us this insight. It's so important right now and so needed for all of us. So thank you so much.
Oh, you're welcome. Thank you.
Have a great night.
Okay, take care.
Take care. All right, so hopefully you guys got some questions answered with this back to school time. I know for me that cleared up some things that I've been thinking about, just looking forward to the next several months. Oh, Melissa, I'm sorry. I just saw your question pop up right now. I think my comments are a little bit delayed tonight. So sorry, I didn't get a chance to ask him that. But we are going to continue to do these week to week. And we always love to know from you guys kind of things that are on your mind, who you'd like to hear from, topics, things that you're thinking about as we wade through this momming journey together. So please let us know if you have an idea for a guest or a topic. We also are doing our weekly poll, which I spoke about earlier. If you're just coming into the chat now and just joining us, we're doing this every week. It's one question and really just a chance for us to connect with you all and kind of gauge your concerns right now related to heading back to school and how your kids are doing in back to school. So please let us know how it's going. I know it's week 1 or week 2 for most of us, so hopefully things got off on the right foot if you started this week and or last. And if it's been a tough one, I hope tomorrow's better, and I hope your coffee is strong in the morning to get you through it, or tea, or whatever you choose to have. So good luck with the rest of the week to all of you mamas, and we always love connecting with you, always love hearing from you, and thank you so much for being with us tonight. Have a great night, guys. We'll see you next week.